Welcome back, everyone. This is Dr. Nikravan, endocrinology and metabolism. I hope you guys are having an awesome day. I get this question asked very frequently. How effective is thyroid radiofrequency ablation long term? Well, since we had the privilege of starting radiofrequency ablation very early on in 2020, we are now approaching our 3 and 4 year data. Our 3 and 4 year data is very effectively. But why do you want to hear it from me? Hear it from Valerie. Hope you have a great day. Here I have Valerie. How are you, Valerie?
I'm well.
Valerie is her 3-year follow-up post-radiofrequency ablation. Where are you from, Valerie?
Denver, Colorado.
Yes. 3 years ago, she started following us and she asked us about this radiofrequency procedure, which was not available anywhere at that moment, which she came to our office in Southern California. Valerie had very large compressive thyroid nodules. Tell us about the nodules.
They were causing a lot of difficulty with swallowing and even speaking. And I had been told that getting my thyroid removed was really my only option.
Tell us about the experience of the procedure and how we took care of it.
Dr. Nikravan was very thorough in explaining how the procedure would go. There was, I feel like, minimal downtime. And the procedure itself went really well, I think. In terms of healing, it just took a few days to feel back to normal, and it was a lot better than, having surgery on your throat, I think.
People always ask about radiofrequency ablation. If the radiofrequency ablation is done in the specific protocol, under the right technique and the right skill set here, the 3-year follow-up continues to show progressive reduction in size. And you can see it's a very successful procedure because you always wonder, does it work? Does it continue to work? Absolutely. If the nodule gets ablated perfectly, it does wonderful. So I'm very happy with the results. It couldn't go better. She goes back to Colorado, beautiful Denver, and going back there and just enjoying her. And, we'll follow her through time and see how she does. But she's done very well. Congratulations. Your 3-year follow-up is amazing.
Thank you, Dr. Nikravan.
My pleasure. Thank you so much. Okay, guys, here you can see a very large compressive nodule on the right-hand side, which is pushing the carotid to the side and also pushing down on the trachea. This patient had clear compressive symptoms. Her nodule volume was 14.65 milliliters, which is a large nodule in measurement. Therefore, this patient decided to proceed with radiofrequency ablation. And you can see the nodule also on the longitudinal view is actually quite large, encompassing majority of the lobe. Here now you can see the 3-year post-radiofrequency ablation follow-up. The nodule volume has decreased to 0.41 from the original 14.65, and yes, that is a 97% reduction and complete resolution of all her compressive symptoms on the right-hand side. As you can see, it's an awesome success for this procedure, and the patient's super happy. Here you can see that the carotid is now pushed back in. You can see all the image in one view, and the nodule has significantly decreased, most likely scar tissue here. Here on the opposite side, you can see she also has a very large left-sided nodule. When she came back for evaluation of the left nodule and underwent radiofrequency of this left nodule, the left nodule volume was 10.21 milliliters, which is actually quite very large and also compressive. This nodule was causing patient to have problems swallowing, yes, as it was pushing the esophagus downward. And here you can see in the longitudinal view, the nodule is actually quite very large and again pushing the esophagus downward. This patient underwent radiofrequency ablation, as you can see right here, and the nodule volume had decreased from 10.21 down to 0.78. Yes, you can see successful improvement. This nodule is now decreased by 92% on the left-hand side. So she had one treatment on the right side first and then came back for the left side, one treatment. And you can see a substantial decrease in size. On the left-hand side, she has a 92% reduction. Patient is super happy. Yes, 3-year follow-up can be very successful.